Most people will see some benefit after one session. It depends on a couple of things. Their lifestyle, so if they don't have a great diet and a very stressful lifestyle and they come in here and we do a few things but they go straight back out, they don't change what they eat and they keep under as much pressure as they were under before, it's probably going to take longer to see a significant result. But if somebody is in a position to make a few changes as recommended, that can make a bigger change. But generally speaking, it also depends on how long somebody has had a particular ailment. So for that reason, very often children get results very quickly. And adults, if it's a chronic condition that's been there a long time, it will take longer to heal than if it's something that's kind of acute and only happened recently.
No, at home now I do, like bringing in the coal and bringing in the shopping and things like that. But I have my son to help me do that. But he's like, he has his own things to do, so he's not always in the house when I'm there, so things just don't get done if I can't do them. I do what I'm capable of doing, but like even changing the quilt covers is a nightmare because the way you have to shake it and and this it really does not move as well as this one. Do you know what I mean? Because I don't know what it is, So.
If you came to see me, one of the things when we're chatting, I will be asking is, and this is going to sound so weird, but I'll say, how does that make you feel? Which very rarely a doctor might ask you. Yeah, but I'm actually seeing, and you're going to go, and you can see it, someone goes, I'm just so angry, why is it there? Or why does this keep happening to me? So now I've gotten two responses. I've got a person who's really sad about it or a person who's really angry about it. Now we're moving into two different remedies. Mm-hmm. So the original symptom that you came with, it's already broadened out. And that way I can find a remedy that best suits you.
Because some people come into me for reflexology, say a new client, and they say, now I hear that you can tell all sorts of things from having reflexology, and all of a sudden you're going, I actually don't know if they say, well, and after the reflexology session some people go, well, what did you see on my feet? It's like, tell me, what's wrong with me,
and we do read feet, we do extensively read feet. But people are inclined to think that we're going to tell them their fortunes sometimes.
If anybody had, some people could be quite hypochondriac, and if they had they think, oh, she's going to tell me there's something wrong with my liver, or she's going to tell me there's something wrong with my gallbladder. So you have to be very, very careful. Even if those reflexes do come up on the treatment, you can't say, look, there's something wrong with your gallbladder. It could be an emotion involved with the gallbladder. All our organs carry a different emotion. It's like, for example, if you're full of fear, that is the bladder, or the kidneys, should I say. So if you're fearful, it affects your kidneys. You need to go to the toilet. You can imagine that. That's a simple one to imagine. But it's like the heart is the love, the hate. If the heart reflex comes up in reflexology, then there could be some hate she's holding there. And it doesn't have to be from just now. It could be something from the past. So you're delving into a lot of things when you work with holistic therapies. There's approximately 7,000 nerve endings in the feet. When you work on these, you are working the whole body. It's deeply relaxing. We work on the left foot, the right foot. I'll be working particular areas. This would be the head area. Thumb walk, and by working big toe, we work in all the head area. The eyes and the ears would be around there, and the toes are all the sinus points. Going through the whole foot, this would be the chest and lungs, this would be the upper abdomen, from here would be the lower abdomen, and then the pelvic line there.
I don't know anything about Reiki. I know yoga makes me giddy, so there's no point in me doing that because I just start laughing when I did try, but I'm just too giddy. Apart from anything else, I wouldn't be able to do it with my shoulder because it's so sore. I wouldn't be able to get into positions that you're expected to get into and things like that.
Some of the holistic medicine where you've got to be very careful if it's a massage on a joint that you may make the injury worse. Something like an osteopath, if somebody has a suspected disc out and they go for spinal manipulation, which we wouldn't do in general practice, that could put more pressure on the disc. But thankfully most people who are practicing holistic medicine have been through courses and they've been through college and they've done degrees even on it. And nowadays I think it's going to become more and more certified and regulated from that point of view, and I think that in a way that's probably a good thing.
Contact a professional association like, say, the Kinesiology Association of Ireland or the Association of Systematic Kinesiology, something like that, because they will be able to tell you of accredited courses that they recognise that would actually give you a qualification and will allow you to get insured, because you need to be insured to practice. So that would be the first place to go. But also, I mean, obviously, go and get some done. And if anybody's looking at a career in complementary therapy, even generally, try them out. Go for them yourself and see what really resonates for you personally. Because that's how you will be a good advocate for whatever it is you practice, if you absolutely believe in it.
And you have to have a certain percentage of clinical practice before you can graduate. When you graduate, you then present yourself, or you can present yourself for registration, which is what I did. And I'm now the registrar with the Society of Homeopaths. And I would recommend to anybody that was thinking about homeopathy to go onto the Irish Society's website where all the homeopaths are listed. These are homeopaths who have trained, have gone through the 4 years, have done postgrad, have gone through the registration process, so you're in safe hands. Because homeopathy isn't regulated in Ireland yet, as a lot of the alternative medicines aren't, anyone can decide they're a homeopath. They can do a weekend course and go, right, get some business cards printed, and they're a homeopath. And they may do some great good. I'm not dismissing that. I'm just saying that if you want to be in safe hands with homeopathy, with somebody who's accountable, who you can get a receipt from and claim from your insurance, then choose someone from the register, from the Irish Society of Homeopaths.
They'd have to understand where I was coming from as well, and they'd have to take into account my lifestyle and what, how soon I would like it kind of fixed as quick as possible, or whether I'm just one of these people that have the luxury of just sitting at home doing nothing, finding aches and pains that can go once a month or something just for a massage or whatever. But I really need, and she would really need to understand that, and she'd have to understand my lifestyle. I suppose kinesiology would probably be the best one for me to go for. After reading through all of these, I really don't know what to expect. It could be the miracle cure I'm looking for, or it could be just nothing,
Right, Lorraine, tell me what it is the main reason you've come here today.
My shoulder,
Right,
is really, really bad. It's actually at the back of my shoulder, going up my neck, going right down,
Here.
right down the back of my arm, and
Okay.
just where your hand was as well, and under my arm.
Okay, how long's that been going on?
It's about 2 or 3 months now at this stage.
Okay. And did you injure it doing
No.
anything?
No,
It's
I
just
didn't.
gradually
It
going
was
on.
just a gradual thing.
So what this does is this will improve the flow of lymph, which is like your body's kind of like your body's waste management system. And we want to try and move some of the toxins away from those muscles and try and move some good stuff in there. So I rub those. I'm also then going to come in here and I'm going to work into here a little bit. How's that feel? Is that a bit tender?
Yeah, that side feels really strange.
Right, okay. So we're going to work into there. And then the other place I'm going to work is at the front. So I'm going to just here, okay. So it's just kind of gentle, firm pressure. And ideally you would do this a couple of times a day for at least a week. We're also going to work here. So these points will help improve the flow of blood to that muscle and to your stomach. It's interesting that everything that's coming up is actually around stomach in various different ways. We're going to start, I'm going to be working on the front of your shoulder. So I'm going to be just working here. And you might feel a little bit of tingling or muscle spasm or sensation down the arm. You might not feel anything. I'm going to also then work here. I think your diaphragm might be involved here too. And then I'm going to work on the back of your neck. And I'd like you to turn over when I'm doing that. Okay. It's rarely always just as it seems. It can be that, your body's just about keeping going the way you live, but then something else happens and it just goes, right, that's enough, something's going to have to give, and that's when the pain can kick in.
Oh,
Right. So it's usually a kind of a combination effect. Now, the points, I'll write down points for the shoulder.
Okay.
But what I'm going to do is email you.
Brilliant.
I'll email you a PDF with the points, where they are, what to do, and if any of it doesn't make sense, let me know.
I will.
And it will be really great to work on those twice daily for about 14 days. Look after yourself.
I will.
And thank you for coming in and for being so open. Give me a shout if any questions.
It's actually, believe it or not, a good bit better. I can move it now, and the pain is still there, but it's a lot more mobile, and it's not as sore as it was. I went in with an open mind, and if it was going to work, it would work anyway, whether I believed it worked or not. So I'm still totally confused by it. I don't know how it works. I don't understand it. At the start, I didn't even have an opinion because I didn't know anything about them, and I still don't. It's still a mystery to me. I'm none the wiser. But kinesiology worked for me. It's a gradual thing. It's not a, bad one day, better completely the next. It's a gradual thing. I'm going to go back to her again to get follow-on treatment for other things that she said was wrong with me. So I'm going back to her. Yeah. See what happens.